Joining us now from Los Angeles is Dr. Gary Richwald. He's the Chief Medical Officer at Real Health. Dr. Richwald, thanks so much for joining us. Biden had the benefit of starting his presidency with vaccines on hand, but polls now show his administration is falling behind on its handling of the pandemic. At least that's the public perception. Is that fair based on what you know about viruses?
Well, you have to prepare for the worst case. And we are right now in the midst of the worst case, whether it be medical, political, travel-wise, follow-up, hospital capacity, primary care capacity. We're at the worst. So this is not where you would want to be. But the president did come out with a very broad list of initiatives that he had put together more or less a month ago and at the beginning of the Omicron. But it's a lot to do at once.
We now know that Omicron is significantly more contagious. Is there any indication that it's more dangerous, more deadly?
Well, I think, I'll be an optimist for a minute and say that there is some data suggesting it may be 50% less virulent. But the problem is when you have a virus that is spreading 4 times faster than Delta, and it's half as virulent, you have an enormous medical problem on your hands. Because yes, people may not need to go on a respirator as quickly. They may not die as quickly. They may not die at all. But they're going to need a lot of medical care. And Americans are used to going to the hospital when they have problems. And I'm not sure what the plan is if we have an influenza outbreak in early January. Again, this is worst case. And then what are we going to do? And how are we going to involve our physicians in this planning? And everybody seems to be standing, hoping for the best case. And of course, I do also.
So I've heard some of the naysayers out there saying that the reason we're seeing spikes in confirmed cases is because people are testing more as a result of the fear that's happening, and that what we're hearing at hospitals is not really true, but rather a result of resignations because of vaccine mandates. What's your response to those counter theories?
Well, I think you're giving them the dignified description as being theories. I mean, I think they are really counterproductive and disinformation. And we need to focus on what needs to be done now. And I think what's really the most important things is to get the boosted people up to having their 3rd shot. So the people who have had 2 shots or 1 shot, they need that 3rd shot. This isn't going to help us for Christmas, but it's going to help us for New Year's and in the period after. I've more or less given up on the unvaccinated. Given the amount of energy and fear and logic that's been thrown at the unvaccinated, the ability to get them vaccinated has to be considered low. However, those that have had 1 or 2 shots, they should receive a phone call, a text, an email, and then another phone call, text, and email. We know how to annoy people in the United States, and we should be doing that because this is for all of our own benefits. So that's number one. Number two is what happens when one of your 500 million rapid tests is positive. We need to get right on it and make sure that our healthcare systems, our doctors, the front line, which is us, the consumer, that they know what to do when they have a positive test. And the third thing is everybody who comes in for a booster should be getting an influenza shot, period. That should be the standard order. And if we have an influenza outbreak, as I mentioned earlier, on top of what's going on with the Omicron spread, there is not going, it's going to be a very happy situation. I hope against that. But we're already seeing influenza break through what we call our threshold level. So we have officially begun the influenza season, and cases are up, and this is a concern.
Dr. Gary Richwald, thank you so much from Real Health in California. Thanks.
Thank you very much. Take care.
Brazil is seeing a